Before you touch yourself again, please listen carefully. Because there's one mistake millions of seniors make during masturbation, and it may be silently damaging your heart, your brain, and even your nerves without you ever knowing it. I'm Dr. Amanda, a specialist in senior wellness, and I've seen the consequences of this firsthand in my patients. If you're over 60 and you still have urges, and that's totally normal, then this is something you absolutely must hear. Your safety, your circulation, even your memory could depend on it. Let's get into it right now. No wasting time. Now, after 60, our bodies don't work the way they used to. Blood vessels stiffen, nerves become slower, hormones shift. So, what might have been safe and harmless when you were 30 isn't always the case anymore. And here's the worst part. The biggest mistake seniors make when masturbating isn't what you might think. It's holding your breath while climaxing. Yes, you heard that right. This simple, unconscious habit can cause a sudden spike in blood pressure. When you hold your breath and tighten your muscles during orgasm, your blood vessels clamp down, and your heart works double time to push blood through stiff, aging arteries. That sharp rise in pressure can trigger a mini stroke, or worse, a full-on cardiac event. Many older adults don't realize this until it's too late. I had a patient, a 67-year-old man, who came in dizzy and confused. Turns out he had experienced a mild stroke, alone, in the bathroom, all because his body couldn't handle the strain of climaxing while cutting off oxygen and pushing his cardiovascular system to the edge. Now, this doesn't mean you need to stop pleasuring yourself, not at all. In fact, healthy masturbation can support blood flow, balance hormones, and help you sleep. But what it does mean is you need to breathe. Slowly, deeply. Inhale and exhale evenly, even during climax. Let your body stay calm. Don't clench. Don't hold your breath. Your brain needs that oxygen. The second danger I see is seniors masturbating in a standing position, especially in the shower. You may feel fine standing up, but the combination of heat, narrow blood vessels, and physical strain can cause a sudden drop in blood pressure. That's how many people faint, fall, or injure themselves. The bathroom is the #1 place where seniors suffer fractures or head trauma. If you feel any dizziness, weakness, or a fuzzy sensation during arousal, that's a warning sign. Sit down, lie down if you can, keep water nearby. You may think, I've done this for decades, I know what I'm doing, but your body over 60 is not the same body you had at 40. It reacts differently, and ignoring those changes can come with dangerous consequences. Another critical mistake is using certain medications or alcohol before masturbation. You may take blood pressure pills, beta blockers, or even over-the-counter allergy meds. These can interfere with how your heart and blood vessels respond to stimulation. Combined with arousal, they can drop your blood pressure too low or raise it too high, causing fainting or irregular heartbeat. Alcohol is especially risky. It lowers your inhibitions, but also your muscle control and awareness of your heart rate. I've had older men fall asleep or pass out while stimulating themselves, only to wake up confused or in pain. Some don't wake up at all. And here's something most seniors never consider. Your nervous system is aging too. Your nerves become less sensitive, slower to respond. So when you push harder or go longer trying to reach climax, you risk numbing the area permanently. Over time, this can lead to weaker erections, lower pleasure, or even total sexual dysfunction. The solution is not to stop, it's to adjust. Use warm compresses before to increase circulation. Go slow. Pay attention to how your body reacts. And don't use too much pressure, either from your hand or tools. That sensation of not feeling enough is common over 60, but more pressure isn't the answer. More awareness is. Also, please avoid watching overstimulating content that triggers adrenaline. At this age, your goal is not high excitement, but deep relaxation and natural flow. Too much stimulation taxes the heart and floods your system with stress hormones like cortisol. That leads to long-term fatigue, mood swings, and even memory decline. You're not 25 anymore, and that's perfectly okay. But you must treat your body with the respect and awareness it needs now. Because your health isn't something you can reset like a video. One wrong move, one small habit can set off a chain reaction that changes everything. And that's why I said this message is urgent. Let's take a breath here, and I'll tell you next what I've never shared before about how seniors can restore healthy sensation, boost arousal, and even reverse numbness in the private area.
Now, let's talk about something that's rarely spoken out loud, but it's real. Numbness or reduced sensation down there. Many seniors start to notice that it just doesn't feel the same. It takes longer, it's harder to climax, and sometimes there's little to no feeling at all. You're not imagining this. After age 60, two things are happening. First, your nerve endings become less responsive. Second, circulation slows, especially to your extremities. Yes, including your private parts. That means less blood flow, less oxygen, and less sensitivity. And here's the key. If you keep masturbating in the wrong way, you're speeding up that nerve damage. Tight gripping, prolonged pressure, or using hard tools or aggressive motions actually dulls the nerves. It's called nerve compression. Over time, you could lose the natural feeling altogether. But here's the good news. You can slow this down or even reverse it with simple, smart changes. First, stop using too much force. Lighten your touch. Switch hands if needed to reduce repetitive pressure. Use natural lubrication like coconut oil or aloe-based gel. This reduces friction and protects sensitive skin. Second, stimulate the area around the genitals, not just the main spot. The inner thighs, lower belly, and even the base of the spine all have nerve connections that help signal pleasure. By engaging more areas, you awaken nerves that may have gone dormant. Third, and this is very important, improve circulation before and during. A short warm shower, a heating pad near your lower back, or even a few minutes of light stretching or walking can wake up your blood flow. Think of it like warming up before exercise. Blood flow equals sensation. And if you're taking medications that affect circulation, like cholesterol pills, blood thinners, or diabetes meds, be extra careful. These can quietly reduce blood supply to your private area. You may need to talk with your doctor about adjusting dosages or supporting nerve health with supplements like B12, magnesium, or alpha-lipoic acid. Also, watch your habits right before bedtime. If you're masturbating late at night after sitting all day, your legs and pelvic area may already have poor blood flow. Try elevating your legs or doing a few seated leg pumps to boost circulation before you start. Now, this part is going to surprise you, but it's something I tell all my older patients. Your mind matters as much as your body. If you're rushing, if you feel guilty, if you're distracted by shame or trying to get it over with, your brain never fully relaxes. That sends mixed signals to the nervous system. Your body won't release feel-good chemicals like dopamine or oxytocin properly, and your climax will feel dull, short, or totally absent. You need to give yourself permission to enjoy it. No guilt, no rush. Create a peaceful setting. Soft music, low light, and even light candles if it helps. Your brain must feel safe in order for your body to respond fully. That's not fluff, it's neuroscience. One final thing. If you've been using the same method or routine for decades, it may be time to gently explore new approaches. That could mean changing your rhythm, position, or mindset. Not for novelty, but because your nervous system craves variation to stay active. Repeating the same movements trains the body to go numb. And for those experiencing erectile changes, don't panic. That doesn't mean the end. It may just be poor blood flow, medication side effects, or tension in your pelvic floor. A pelvic therapist or urologist can help identify solutions. Remember, your sexual health is still a part of your overall health. It's not something to be ashamed of. But over 60, it requires more awareness, more patience, and more care than it used to. So please, don't stop. But don't ignore the signs your body is sending you. Masturbation can be safe, healthy, and even healing if you respect your body's new limits. Breathe, stay gentle, pay attention. You deserve pleasure, but most importantly, you deserve safety. I'm Dr. Amanda, and if this helped you understand your body better after 60, don't keep it to yourself. Many others need to hear this truth. Stay safe, stay aware, and stay strong.